The COVID-19 pandemic has affected everyone in the United States, but minorities are being hit even harder, according to a recent study. Cronkite News reporter Delaney White spoke with a COVID-19 survivor about the reason behind these alarming number of COVID cases in these communities.
I talked to COVID-19 survivor Christian Lopez about his battle with COVID and the reasons minority communities are so disproportionately impacted by the virus.
Many immigrant communities and communities of color lack credible information pertaining to COVID-19 prevention, often leading to higher case counts and mortality, according to a study published by Clinical Infectious Diseases. Dr. Mark Wieland of the Mayo Clinic is working to change that through the distribution of multilingual messages to immigrant communities.
Death rates are 2.4 times higher for African Americans compared with whites, and 1.5 times higher for Hispanic or Latino and indigenous groups. And this crosses over intensely with socioeconomic status.
The same study concluded that those of a lower socioeconomic status are more at risk for exposure to COVID-19, often due to crowded living conditions and essential worker positions. Christian Lopez, a restaurant worker, says he needed to return to work after feeling financial strain.
It happened to me a little bit later in COVID season, and mainly because I was tired of being stuck at home. And not that I purposely went out looking for it, but I just realized that I had to do daily tasks, and I was in the workforce because I can't, I couldn't afford to stay home any longer.
Shortly after returning to work, Lopez says he and his roommates contracted COVID-19.
So from a biomedical aspect, the higher infection rates and deaths in these minority low socioeconomic status populations are related in part to existing health inequities, namely higher rates of chronic diseases that lead to worse COVID outcomes like diabetes, obesity, hypertension, and so forth, as well as disproportionate barriers to healthcare access and utilization.
One of the biggest risk factors affecting minority communities is the lack of access to healthcare.
Healthcare is still a huge issue, especially with those communities, because of a lot of, they have such big families and they are in such low income areas. They're not able to access a lot of that still.
The Rochester Healthy Community Partnership highlights how medical experts can partner with community leaders to bring reliable health information to minorities. In early March, RHCP found that even though there was credible COVID information being produced in many languages, it was not reaching immigrant communities.
We adapted the CDC Crisis and Emergency Risk Communication Framework, which can be used to encourage public participation in disease prevention and containment. And the principles of the framework really resonate. So they are things like to be correct, to be credible, respectful, to promote action, and to engage with communities in order to empower decision-making.
The information is now being distributed by more than 26 communication leaders in 6 different language groups. Delaney White, Cronkite News.